live stream now.
Thank you. Good morning, everyone. Welcome to the Health and Government Public Health and Minority Health Disparities Subcommittee. Today, we have on the agenda House Bill 368, House Bill 783, House Bill 1280. I know Erin Hopwood, our counsel, sent the committee the material beforehand, so you all received it. I was saying before we started that the task forces that we have here, the chair and I in leadership review, and there were task forces that were in last year. They're important issues. They have been worked out. They have also passed the Senate. With that being said, we're going to today, we invited, as you know, public health is very open, and we invite everyone to come to the table so that we can have a good product. Everyone who's here has an opportunity to speak, and please ask your questions. This is the place to do it. So thank you so much. We're going to start with House Bill 368, which is the Task Force on Oral Health in Maryland. Erin, will you please start by telling us what the bill does? Okay, what, if there are any amendments, what they are, and then we're going to open it to those that are present so that you can tell us your position. And then, you know, committee members, if you have any questions of the council or the stakeholders, please ask your questions here. Erin.
You all have a copy of the bill as it passed the Senate. This is the Task Force on Oral Health in Maryland. The task force will analyze the current access to dental health services for all residents of the state with a focus on socioeconomic status, race, ethnicity, age, and disability of residents as factors impacting access to dental services. The task force will identify areas of the state where a significant number of residents are not receiving oral health care services, distinguishing between the pediatric and adult populations. The task force will identify barriers to receiving dental services in the areas identified and will also assess options to eliminate the barriers that are identified. This is a 2-year task force, and there are individuals on the call to discuss the task force if you have any questions.
Okay, any amendments?
The amendments I read were
the ones adopted in the Senate?
Excuse me?
The ones adopted in the Senate?
Yes, they are the amendments that were adopted and passed by the Senate.
Okay, so thank you, Erin, for your work on this. We appreciate you. So who would like to speak? Will you be so kind? And under the participant icon, if you will raise your little hand where it says raise hand so that I can do it in an orderly fashion, that would be wonderful. I'll call on you as well if I can recognize what bill you're here for. So I'll start with Daniel. Go ahead, Dan.
Thank you, Madam Chair. This bill originated a number of years ago when we were before your committee dealing with some issues of dental auxiliaries and whether or not there were sufficient dental personnel to deliver care. Following that hearing, I had a conversation with Chairman Pendergrass, and she acknowledged that the problem in Maryland was, at large extent, one of money. But we both agreed that there were a lot of barriers to the access to care that could resolve some of the problems without necessarily incurring additional costs to the state or Medicaid. So amendments were done to the bill at that time. They were passed by the committee, but never got to the Senate, and the bill has been back. It's ironic, last year, what was then Senate Bill 511, now Senate Bill 100, passed the Senate unanimously. Well, there may have been one dissenting vote, and was scheduled for a hearing a year from tomorrow, St. Patrick's Day. And of course, we all know what happened to the session. So we're back again this year. It's a bill that I think brings as much as you can in terms of input from various interest groups, advocacy groups, and professionals. It is chaired by, I think, the appropriate type of chairs. They are not advocates for any particular segment of dental advocacy, whether it's representing dentists, hygienists, consumers, but it's the dean of the dental school who obviously knows about the education of dentists, is aware of the education and cost of dental hygienists, and has been intimately involved in the discussions of this bill since the beginning. And the other co-chair is the Deputy Secretary of Public Health. I think two very appropriate chairs. The goal is to have hearings conducted, meetings conducted, have input made from all segments of Maryland, and try and get to the core issues that are stopping people from getting care. Things are exacerbated this year because of COVID. Many of the people who were on the fringes, some getting care, some not getting care, have now fallen through the cracks because of impact of COVID on their lives, whether it's economically, whether it's because they're fearful of the virus and whether or not they will be further exposed by getting dental treatment. So now is a perfect time to try and pass this bill. Let's get the task force going. I think we have the right makeup, and I really would urge the subcommittee to give it a favorable report.
Thank you. Is Robin, are you here to speak on this as well?
I am. So good morning. Robin Elliott here today on behalf of the Maryland Dental Action Coalition. You all have heard us many times and know that our top priority is looking at dental access. We did raise a question to the bill sponsor regarding the co-chair of the committee. One of the things we've noticed is this committee is intended by and large to advise the Department of Health and the Maryland General Assembly on future actions. And so sometimes when we see that, it creates a little bit of an awkwardness if the state agency is actually co-chairing the committee. So that is one of the issues that we've just flagged for Delegate Bagnall. And I see her nodding, so I don't know if I should finish and hand it over to her, or I think she's.
So my question to you, Robin, is that the way the bill stands presently, it passed the Senate. And what was the vote in the Senate?
It was unanimous.
Okay.
And Delegate Pena-Melnick, we did raise some of these questions with the bill sponsor there.
All right, so I just wanted to finish my sentence, if I may. So past the Senate, the way it's presented, unanimous. Are you concerned at all that, is this gonna really, is it really, would it break the bill? Us making changes, ended up in conference, you're not concerned about that? Once we hear from the, from the sponsor of the bill?
Thank you for that question. If the committee were to make this change, we would absolutely pledge to work with everyone to go back to the Senate to ask them to concur with what the House did.
Delegate Bagnall.
Thank you, Madam Chair, and I apologize. I'm currently in two committees on two different bills. So I did raise this concern with Mr. Doherty, who confirmed that they had worked extensively with the dean, so we didn't want to touch that co-chair position at all. But my concern is not just the awkwardness of the health department, but also that the health department is fairly stretched with COVID. And given that this work is that we're going to attempt to do this work over the next 2 years, I don't anticipate that workload for the health department is going to decrease. But I always defer to the will and the judgment of the subcommittee.
Dan.
Yes, thank you. To my knowledge, and I could be wrong because getting information about who's doing what on these hearings this year has been difficult. I don't think the department has objected per se to who's the co-chair. I think it is absolutely critical that the co-chair be in a position of understanding public health and access, but not be an advocate. I do not know, and I've not seen any amendment that MDAC is proposing to be the chair in place of the Deputy Secretary of Public Health. So it's a little hard to approach it from that standpoint. But I think we're dealing with a bill that was sponsored by every member of the Finance Committee 2 years in a row, has passed the Senate unanimously. I don't think that this is an issue that should in any way change the bill. I think that the chair, co-chairs are appropriate. And I haven't heard anybody offered as a substitute and compelling reasons to change it. If our health department cannot address things objectively, even though to some extent these things fall under their purview, I think we have problems. Certainly, and I will use my client as an example, if you put a representative of the MSDA in as co-chair, they could try and be objective, but everyone knows that we're an advocacy group for licensed dentists. And I think that could give some slant to whether or not the chairs are as objective as they should be. So I really would urge the committee to leave the chairmanship, co-chairmanships the way it is.
Samantha, can you tell me who you represent? Is it rural? Who do you represent?
Sure. Hi there. Thank you, Madam Chair, and thank you to the committee for allowing me the opportunity to participate. My name is Samantha Oraz, and I represent the Maryland Rural Health Association. And so I would just like to first say that we are in support of this bill that works to reduce barriers and increase access to oral health services in rural areas. We are also in support of including the Maryland Dental Action Coalition as the co-chair on this task force to ensure that the consumer voice and those rural perspectives are both heard. Oral health services are frequently underprovided in rural communities, and the establishment of this task force and the incorporation of this consumer perspective to guide this task force will be key moving forward.
Dan.
Yes, this is the first that I'd heard who was proposed to be the other co-chair. I think we all recognize the role that the Maryland Dental Action Committee has performed in Maryland dealing with oral health going back a long ways, but they are in fact an advocacy group, and they have their predisposition on issues just as my client does. And I think it would be inappropriate to put any advocacy group like that in as co-chair. And I think the objectivity of the ones who are contained in the bill is essential.
Okay, so now I'm opening it to the committee, my members. Any questions? This is your time. Any feedback? Anything you want to add to it? Any concerns? Any proposals? You can raise your hand at the little icon. Okay, I don't see anyone that has any questions or concerns regarding the bill, although we have a little problem here. As they say, Houston, we have a problem because there's disagreement on the co-chair. So I would be inclined to say that we should go with the bill the way it is, the way it came from the Senate, unanimous. The bill, the issue, was this issue brought up in the Senate, Robin?
No, we submitted a letter of information. So when we do that, we aren't called to testify. And of course, they have limited testimony in the Senate.
Okay, but this issue didn't come up in the Senate?
Not in the hearing.
Not in the hearing. And were the members aware of this issue?
I did raise it with Senator Kelly at the very beginning of session, but we know that she does have a lot to do, so we appreciated the time that she spent with us.
So I think that having the Department of Health and having the dean of the school, they're neutral and they can advise. You're still going to be a member of the commission, correct, Ms. Oraz? Of the task force?
the Maryland Rural Health Association, I do not believe will be a part of the Oral Health Task Force. That is something that I am not aware of. I'm sorry to report
Okay.
that I don't
So-
have that information.
So then tell me
They're
about
not listed.
what advocates are part of this task force.
Okay, if you look on page 2 of the Senate bill, you have a list of 10 participants who are designated by their association. When we did the original language in negotiations with various groups, we all agreed that we need representatives from nonprofits that advocate for the health needs of the poor, et cetera. But the decision was made, directed by the sponsor of the bill at that time, that those appointments should be made by the co-chairs and to give flexibility. At that time, the coalition of oral health in rural areas was not at the table. And if they had been and had voiced their opinion, they would have been considered. But I think there is an opportunity for them to be appointed, and certainly even if they are not by the co-chairs, they're going to be given adequate opportunity to come and provide information. And in fact, we would hope that everybody in a situation that has input and interest like they do would be invited and would participate.
I think, Dan, that they were not at the table and they may or may not be appointed. And I think that the rural areas need to be represented as well. So I would move that oral amendment that Erin can capture to allow them to be part of the task force, because I think we need to balance that with everyone else. So this is what I propose for the committee, and please let me know if you do not agree with this. Basically, I would make an amendment to allow the rural task force, the rural areas to be included, the organization that Ms. Orris represent. And then I would like to take a vote on that. And then I like to move the bill as amended with those changes. So
Can I just get clarification quickly? What is the name of your group so I can just have it right?
Sure, it's the Maryland Rural Health Association.
So that would be in the bill, you'd be selected by the organization, correct? And it would be the Maryland Rural Health Association.
And if I may, are we adding that as 6-11? Would that be where it would go?
Yes.
Okay.
yes, okay. So committee members, with all due respect, I move that this amendment, adding them, be adopted. Any discussions or concerns about this? All those in favor say aye.
Aye.
Any opposed? Seeing none, that is unanimous. On the bill as amended with that amendment, is there any concern or discussion from the members?
Motion to move the bill.
Second.
It's been moved in second. Any questions or concerns? All those in favor say aye.
Aye.
Any opposition? Seeing none, thank you so much. Thank you for the discussion today. We really appreciate you, okay? And we value your input.
Thank you, Madam Chair.
Thank you very
House
much,
Bill-
Madam Chair.
My pleasure, our pleasure. House Bill 783.
783, you have a reprint of, and this is the version of the bill as it has passed the Senate. This establishes a work group on screening related to adverse childhood experiences. It contains membership across the health and education sectors. On or before October 1st, 2022, the work group will update, improve, and develop screening tools that primary care providers can use in a primary care setting to identify and treat minors who have a mental health disorder that may be caused by or related to an adverse childhood experience. The work group will submit the screening tools to the Maryland Department of Health. and recommend changes to the physical examination form that the State Department of Education requires of all new students entering a public school, including requiring that a physical examination include an assessment of trauma. It will study and make recommendations on the actions a primary care provider should take after screening a minor for a mental health disorder that may be caused by or related to an adverse childhood experience. The work group will also study best practices in youth risk behavior survey data summaries and trends reports from across the country, including those that report on adverse childhood experiences. And this is also a 2-year work group that will report its findings. I'm sorry, this is a 1-year work group. So on or before October 1st, 2022, the work group will report its findings and recommendations to the governor.
Okay, who's here on this bill?
We don't have anyone here on this bill.
Okay, great.
Besides Delegate Queen, but
I'd like
Excuse
to
me?
move the bill.
I
Yes.
can tell you who testified in favor if you want, but there was no
Yeah.
opposition.
Actually, can you hear me? Can you hear me? This is Delegate Lewis.
Delegate Lewis, can you hold on 1 second?
Yes, ma'am.
1 minute, please. So this bill was actually similar to Delegate Lewis. It was introduced last year as well, just for the committee to know. Delegate Lewis.
Thank you, Madam Chair. Forgive me, I'm in transit, so thank you.
It's
I
okay.
felt that this bill asked some really important questions. For example, how can we bake in an approach to childhood trauma in our healthcare delivery system? How do we do that effectively? And that's a really important question of many questions the bill attempts to answer. But I was concerned that there may be some duplicativeness between this bill and the other, the health. Sorry, I'm in transit here. My bill on trauma-informed care, the Maryland Trauma-Informed Care Act. And I think it would be helpful if we could have some discussion about the merits of both bills and figure out the best way to get the best policy, given the proposals we have. Thank you.
Not a problem. Delegate Riley?
Yes, thank you, Madam Chair, and thank you
Pleasure.
for the bill. I just had a couple questions. I don't think in the bill, actually, I guess it's to leave, well, the question is, I guess we're leaving this to the study group. The definition of actually adverse childhood experience. I mean, that's kind of broad. I mean, I'm not sure what you're looking for here. Physical, and then require a physical examination to include an assessment of trauma. I mean, trauma is not really defined. It's kind of, I don't know, is it too broad that this work group is going to look into every aspect of every child's life and their home situation and their work situation and just continue? So I think, that needs to be addressed. And then at the bottom of the bill, it talks about youth tobacco survey. So there's a sentence in there about that. So is it going to be as broad as, finding out whom smokes in your household, or how that affects our students? If you could explain those things, that'd be great.
I can say that
Eric.
adverse childhood experiences are a well-known public health term. It's defined.
But could you give me some of that definition then? Because I'm not familiar with it.
Put something in the chat, by the way.
They're a category of early life traumas which negatively impact long-term health, prosperity, and social mobility outcomes. And that's a CDC site.
Okay,
That's,
that's in CDC.
It's
Yeah,
in the
so I
chat
mean,
room.
It is definitely a well-known and defined.
Yeah, the link is in
Okay,
the
so I
chat
can
room.
look it up, so I can find
Yeah.
out. Okay.
Yeah, it
All
is. I was gonna say it's a respected term, really well known among public health
Okay.
professionals.
I guess it's in one of the, does it have an article number or something, or?
Is it-
that I can
I
look it
don't
up?
think it's defined in state law, but you could look under CDC and
Okay, all right,
find adverse childhood experiences.
okay.
And the link is in the chat room. To it. And then, Erin, what will you say to Delegate Riley's point regarding the smoking?
Well, they're looking at using the youth risk behavior survey data. So what exactly is your, I mean, I know that that survey is given. I think they would just look at other ways to use the data from the survey.
Okay, just as I was reading through the bill,
Adverse
it's kind of
childhood
odd.
experience.
Yeah, that wasn't mentioned, and then until at the very end, and then, lines 36 and 37 make recommendations improving the youth risk behavior survey and the youth tobacco survey, and surveys, data, and trends reports. So I didn't know if that, once they make the study, are they gonna, what are these questions? What are they actually looking for? That they're going to go to these homes or go to the schools to figure out what the trauma is that this child is going through. So,
Yeah, it says make recommendations for improving the youth risk behavior survey and the youth tobacco survey, which is something that is done. It says including, if you go to the next page, whether the
right.
school expanded to reach those students in middle school or high school, whether the analysis and reporting should be made publicly. So they give some questions for guidance and then they just leave it open for discussion.
Okay, all right, thank you very much.
My pleasure. Thank you for your questions. Next, we have Delegate Chisholm, followed by Delegate Shalega. Delegate Chisholm.
Thank you, Madam Chair. And
My
I
pleasure.
think that Delegate Lewis brings up a very good point, because I did go back, because I've recalled this as well. She's got House Bill 548, which is a Human Services Trauma Informed Care Commission and Training. And it's, I guess the question is this duplicative? Are you going to move forward with one bill, or are we going to move forward with both? Or are they going to try to work together? That's more of a question for Delegate Lewis, I guess. I don't know if she's had any conversations with Delegate Queen, because the physical note's almost exactly the same. A lot of the verbiage is the same. It's a little different, I guess, mechanism, but it's one's a commission, one's a study. And
Thank you.
I don't know if Delegate Lewis has talked to Delegate Queen.
Well, it's a good point, and I think what we'll do
Should I answer? Should I answer
is-
that
Oh,
question,
go
Madam?
ahead. Absolutely.
Okay, thank you. Thank you,
My
Madam Chair.
pleasure.
Thank you,
Yeah.
Delegate Chisholm, for your question. I have not had an opportunity to speak directly with Delegate Queen, and I agree that would be a great thing to do. So I
I
would
think-
certainly be willing to, whatever you recommend. I defer to the will of the subcommittee.
Yeah, I think Delegate Lewis, that Erin and I will, I'm going to hold the bill today so that we can have a discussion with the chair as well, okay? And we'll be able to talk to you as well, all right?
Very good. Thank you, Madam Chair. Thank you.
Thank you,
My
Madam Chair.
pleasure.
Thank you, Delegate Lewis.
Thanks, Delegate Chisholm.
Good
Thank you.
points. Good points. Delegate Shalega,
Thank you, Madam Chair.
my
So
pleasure.
we're asking MDH to do this, Maryland Department of Health, is that correct?
Yeah, and then,
Yeah,
in
'cause we held it.
go ahead, Erin.
No, I put the bill down because we held it.
Yeah, and in the fiscal note, there is actually an expenditure for one contractual position.
Yeah, they'll staff it, correct.
They're gonna
So we're
staff it.
asking Maryland Department of Health, which on a side note, we really, I personally would like to really focus on COVID, not this, but, we're giving them a lot of duties in this committee, additional responsibilities, but, so I'm familiar with a couple of those surveys that are mentioned in the fiscal note. Who's collecting this data and what are they doing with it? So we're asking MDH to develop a survey, then walk me through what this looks like. Then every public school kid is asked this, or their parents, or the kid,
it's-
or what?
It's a work group. The fiscal note comes from MDH staffing the work group. So, and we're not asking MDH to do anything else other than staff the work group.
And the
and then
fiscal note gives them
Have
money
to help write the
for,
report.
yeah, for
why
someone to
aren't
be
we
But
hired.
it's all recommendations.
Well, why aren't we asking Department of Education to do, that's where I'm confused.
I think because the focus is more on adverse childhood experiences and their impact on health.
Yeah.
But
Which are
there is an
medical
education
related.
component to it as well.
Yeah.
Okay, so,
But I think it's more heavily weighted towards the health aspect.
so the work group is tasked with developing a survey.
No,
Asked
they
to,
have several duties.
So the work group has to update, improve, and develop screening tools for primary care providers to identify and treat minors who have a mental health disorder that may be caused by or related to an adverse childhood experience. The current law actually requires a physical examination for each child that is entering the Maryland public school system for the first time. So then what this work group does is that it has to update and improve and develop screening tools for primary care providers, those that are doing this examination of these kids that are coming in, so they can identify and treat minors who have a mental health disorder that may be caused by or related to an adverse childhood experience. So they want to catch it early, and they feel that at the beginning, when that examination is being done, that primary care should be sensitive to that and try to look for that, because all the data in the public health studies show that if you capture it early and you treat it, then you prevent all these other problems later on when you are in elementary school, middle school, and high school. And it says that submit the screening tools to the Department of Health. Recommend changes to the physical examination form that the Maryland State Department of Education requires for all new students entering a public school. And it has all the different tasks on page 2 of the fiscal note. So they're doing a lot.
that was, I was reading that. It was my question, and I know we're holding the bill, but when we come back,
It's okay.
the question is, who is collecting this data? Who will have access to this data? What are we doing with the data? So it's more than just the primary care physician, because it also talks about that other survey. There's 2 other surveys that I know they use in public schools. So, I'm sensitive to student data being collected and who gets to see it and what we're doing with it. So those will be
Those are good questions.
when we revisit. Thank you.
And we can actually, thank you for bringing them, bringing those questions up, Delegate Shalega. What we'll do is we'll find out who's collecting the data and who gets to see the data. Any other questions that we should submit? Delegate Shalega? Any other questions besides those 2? You're muted.
Yeah, sorry, I thought I was finished. Yeah, yes, exactly. If you're going to start asking, who are you asking? Parents, kids, you've got the Department of Education, you've got their primary care physician, we've got, we don't want medical records floating around in the public schools, or I don't want that going on. So yes, thank you.
My pleasure. Thank you for the questions. Delegate Bagnall, followed by Delegate Hill. And 1 second, Erin, did you get those questions?
I did, yes.
Okay, thank you so much. I appreciate you. Delegate Bagnall, followed by Delegate Hill.
Thank you, Madam Chair. And
My pleasure.
I just wanted to sort of reiterate, I know that I just brought up a concern about the Department of Health, but I think in this case, it's very important. It remains under the Department of Health, because we've had several issues that have come up around behavioral health where we defer to the Department of Ed, but as even Dr. Kerwin said when he came before our committee, those are educators, not health providers. So it's very important that when we're talking about health services, even though the venue is an educational setting, the expertise is still in the realm of the Department of Health. So I just wanted to reiterate, I think that is very appropriate that it remain under sort of the auspices of the Department of Health.
Thank you. Delegate Hill.
Thank you, Madam Chair.
My pleasure.
I just wanted to clarify what my understanding is of what this is trying to do. As you did, ACES is a well-described, documented, and accepted entity that exists in public health. And we've been doing an awful lot of work sort of, at the back end, trying to ensure we have improved behavioral health supports for our adults, that we are dealing with criminal justice issues, that we're dealing with a whole lot of stuff that we, research is showing really dates back for many, many, many people to the kinds of experiences they understand. It's sort of like the recognition that it's not only our veterans who have post-traumatic stress syndrome, right? And so the data that this commission, this work group would be looking at is really de-identified data, right? It's data that's not specific to particular students, but what we're looking for is how, as a state, we can do a better job of being proactive in identifying who and how, who needs to be treated, how they need to be treated, and how that can best be done. And this is really a work group that is supposed to look at the tools available and come up with specific recommendations about how we can best use it to serve our entire state population. And Aaron, am I missing something, or is that pretty much what this is about?
And that would be part of it, absolutely.
I just wanted to make that clear, because when all the questions that are raised are good ones, but again, this is de-identified data. It's not sharing students' individual information.
And we're going to get confirmation of that because they're valid questions for Delegate Shalega. Thank you, Delegate Hill. Are there any other questions or concern? Will you be so kind and let me know now so that Erin doesn't have to go back and forward and she can get it all at once and try to get us the answer she needs? Any other concerns you have about this bill? Any questions, new questions? So basically, Erin will find out those two questions that Delegate Shalega just asked, confirm that it's actually de-identified data that is not shared. In addition, we will discuss Delegate Robin Lewis's bill with this bill and take into consideration Delegate Chisholm comments regarding, can they be married? Can we look at them together side by side and see what we can do? And I thank you for bringing up all those issues as well. So we're going to hold it and do a little work and come back to you. Erin, do you have anything else you'd like to say regarding this bill?
No, I think you summarized it well.
All right, thank you very much for your input. It's definitely valued.
Yeah, next bill. All right, wait,
Delegate Riley?
no, I'm good.
Okay, wonderful. Next, we have the last bill of the date is House Bill 1280. Erin, will you be so kind and tell us what the bill does? We have the Office of the Governor's Office, Lieutenant Governor's Office here as well on the bill. And we have the Senator's Office who have been honestly leading the conversations on this bill and meeting with all the stakeholders. Thank you for your work. Erin, will you be so kind and get us started?
This bill establishes the Maryland Community Health and Public Safety Center of Excellence within the Governor's Office of Crime Prevention, Youth and Victim Services. The center will do strategic planning, provide technical assistance, and state and local government coordination. The bill establishes the priority for dispersing any federal funds the center receives and requires each local jurisdiction to develop a 2-year community health and public safety public plan. Just of note that the final report of the Commission to Study Mental Health and Behavioral Health that was chaired by the Lieutenant Governor recommended the development of a mental health criminal justice center of excellence. You have a version of the bill in a reprint version that reflects amendments that were agreed upon by stakeholders in this bill. Of note is that the center will act as the statewide information repository for behavioral health treatment and diversion programs related to the criminal justice system. The center will lead the development of a strategic plan to increase treatment and reduce the detention of individuals with behavioral health disorders involved in the criminal justice system. The Governor's Office of Crime Prevention, Youth and Victim Services will appoint certain individuals to jointly oversee the center. Those individuals include a crisis intervention law enforcement coordinator, a mental health coordinator, and any other individual that they determine is necessary by the office. This center will provide technical assistance to local governments for the purpose of sharing practices across jurisdictions, applying for grants to support work related to behavioral health, public safety, or criminal justice, facilitating the distribution of resources, technical assistance, and training in best practices related to behavioral health, public safety, or criminal justice. The center is required to develop a statewide model for law enforcement assisted diversion, recommendations for pretrial services, procedures for sharing deflection and diversion statistics between state agencies, recommendations for statewide implementation of law enforcement assisted diversion programs, and a statewide model for community crisis intervention services other than law enforcement. We have some individuals on this Zoom who can provide further detail.
Thank you, Erin. So first, I am going to call on the office, the Lieutenant Governor's office, the Governor's office, Jake.
Thank you, Madam Chair. First, I just want to thank you for sponsoring this bill. As Erin mentioned, this is part of the Lieutenant Governor's recommendations from the Mental Health Commission, and we think we can do a lot of good with this. We've taken a look at the amendments and we've worked with the stakeholders, including Nathan, and we're happy to support this and humbly request that the committee move forward with a favorable vote.
And thank you so much. And you can thank the Lieutenant Governor for his support. Really appreciate it.
Absolutely.
Will you please address the subcommittee and tell us what stakeholders you work with and we work with in getting the bill to where it is today and why the bill is so important?
Absolutely. Thank you, Madam Chair, and thank you,
My pleasure.
delegates, for having me today. We work with a broad, diverse group of stakeholders on this bill, ranging from the Anne Arundel County NAACP, CASA, Ms. Ann Seacott, who's on the call today, NAMI, MHAMD, the Lieutenant Governor's Office, GoCap. We did consult with the Behavioral Health Administration, as well as the opioid, the OOCC, headed by Director Shu, who also provided a letter of support for this bill. We think this bill is really important.
And also, did you work with the rural office, didn't you?
Absolutely, Delegate. Thank you so much for reminding me of that. There was quite a bit of stakeholder engagement on this bill, but the Rural Maryland Council did help us refine the bill and include some rural priorities in the legislation. The reason we believe this bill is so important is because, according to the estimates that are out there by MHA, 39% of our local jail population may have a behavioral health illness, or they're estimated to have a behavioral health illness. And 9 out of 10 of those people are expected to have a co-occurring substance abuse disorder. For those individuals, their stays in prison and jail are often longer. Their care is more intense. They have concerns there's often issues with maintaining their own safety within the jail and incarcerated system. And for those individuals, creating a systematic effort to provide them treatment is a more efficient way to handle their issues, to make sure they can lead productive lives as Marylanders, and to make sure we relieve pressure on our own criminal justice system, who do struggle to interact with and help these people. In the course of our stakeholder engagement through the Sequential Intercept Model Summit, we found a large appetite to engage in this work from across the spectrum, from NGOs, stakeholders, and folks within the criminal justice system. And setting up the structure will help facilitate that work and make sure it's done correctly, efficiently, and with all the experts in mind. So for that reason, I would respectfully request a favorable report for this bill.
And Sika? Thank you.
Thank you, Madam Chair. I don't have much to add. We think that we are moving toward a greater understanding that behavioral health needs are not well addressed in a criminal justice structure. And the more we can do to get people the mental health and substance use treatment that they need, the better. The better it is for individuals, families, communities, and to be honest, the state budget. So we absolutely want to see things like this move forward.
Thank you. I have questions now, if I may open it for the committee members. This is your time to ask questions, to express your concerns, to comment on it. We have first Delegate Hill, followed by Delegate Chisholm, followed by Delegate Lewis. Delegate Hill.
Sorry, should have brought that hand down. Done. No question.
So sorry, I know you didn't have a question. I apologize. I didn't get that. You should have brought the hand down. Not a problem. Delegate Chisholm, followed by Delegate Lewis.
Thank you, Madam Chair.
My pleasure.
Whoever can answer this, I guess first off, sometimes we get so technical and policy heavy that, can somebody give me a real world example? So we're talking here that, let's say an individual is picked up, there's a possibility they're either have a mental health problem or are on whatever drug or an alcoholic. They're going to go to this center. Am I correct on that?
No, the center is supposed to come up with recommendations for the local government on how to deal with, people that are in the criminal justice system. So when you look at the sequential system, you start with 0, where people first get in trouble, to try to pay attention at that level and see if they have a mental health, rather than go to the court in the criminal justice system, perhaps offer diversion. Then as you move for pretrial, to do the same identification as you move to sentencing, to do the same as they serve time and they're coming out, to come up with solutions so that the recidivism rate is not so high and we keep them outside the system. So this is a model to work with the stakeholders and behavioral health to keep people that are really sick and should not be in the criminal justice system, so they can get the help. So this is sort of the structure they would, trickle down advice and a system that all the local government can use on how to treat people that are in the criminal justice system to try to find care. I don't know, Jake, if you would like to add or Nitin on it.
I think that's right. The center's more for making recommendations and developing policy rather than a physical location to send folks.
Well, it's a strategic plan, which answers my next question, because I did look at the physical note, and relatively speaking, it's a lower physical note. And when I was hearing everything else that was being discussed, I didn't know where those funds were going to come from. I know some of them are federal, but okay. So it's essentially looking at it more strategically, putting together a plan. It's not really developing a whole new, I guess, commission or different structure.
That's correct. That's
Okay.
correct. And GoPup is willing to house it right there. So that's why the fiscal note is not huge, because
Okay.
they have the structure.
Okay, thank you.
Thank you for the question. Next, we have Delegate Robin Lewis.
Thank you, Madam Chair. Thank
My
you
pleasure.
for the bill sponsor and all the great input. My question is this: with regard to the stakeholder participation, were there any stakeholders involved in developing this legislation who had actually experienced incarceration and with the behavioral health challenges? It just occurs to me because one of the phrases we hear a lot these days is nothing for us without us, and that solutions are best developed with the insight of folks who are most directly affected. So that would be my question. Thank you.
So we had, and I'll let Nitin speak after I do, we had real participation in the drafting by the Public Defender's Office, who, represents people that cannot afford a lawyer in the criminal justice system, and they were very much involved. Nitin, you can go ahead.
Absolutely. And I would say, just to add to the chairwoman's point, This legislation was developed based on the recommendations from the Sequential Intercept Model Summit that we held last November. So it's an outgrowth of the work that was done to create that report. In the creation of that report, we did engage with folks who had been previously incarcerated, notably on peer support services, which did find its way into the bill. So while all I can add to the chairwoman's point is that they have been involved in the process in terms of developing the initial report, and then in the drafting of this bill, focusing on OPD, and then making sure that we have their stakeholder engagement from the original report reflected in the actual legislation.
Thank you, as well as in the ultimate recommendations.
Yes, the ultimate recommendations were based off of, so on day one, we engaged with stakeholders to highlight best practices. On day two, they formed breakout groups to form those final recommendations. So there were folks who were previously incarcerated on those breakout groups.
I guess, thank you so much, Nitin. I beg your pardon, Madam Chair, but I'm trying to understand, are there, because I don't have the bill in front of me, forgive me, but are there those who've experienced incarceration who will be participating in the work group, developing the recommendations going forward? That's what I was trying to get at. Thank you.
Delegate Lewis, I don't think I have that answer for you at the moment. In terms of the legislation itself, the specific language does not say that, but I'm happy to follow up with you and talk about how we can make that work and happen.
Thank you so much. Thank you, Madam Chair.
Not a problem. Delegate Hill.
Thank you, Madam Chair. And I apologize that I don't know this answer, but this is the time for me
This is a time to ask them. So
yeah, moving forward with this, you know, there have been problems where psychological evaluation tools that were developed for medical purposes were misapplied to determine, for instance, which people in the criminal justice system were likely to reoffend. And even the developers of the tools have talked about the misapplied. Does this legislation going forward look to make sure in the sequential intercept model that the tools being used are appropriate in what they're being applied to, or is it just assumed that whatever tool is being used, if it's been used for X number of times, that it must be accurate? Is that?
Yeah, I think in the bill, one of the technical assistance, it says sharing best practices across jurisdiction. So I guess one can imply that you're going to, by looking at best practices, that you're going to learn about what that practice is, right? What works, what doesn't work. So I would say that it is implied, I think, all over the bill.
See, I think that may be, and I'll try and get better information, that may be the problem. We've been using tools as best practices that are inappropriate for what they're being asked to do simply because they were available and simple to get to. So I'll try and get more information back to you, Madam Chair, about specifically what I'm talking about. But that is a little bit of, I mean, the bill is good, but I would love to have something in there that requires us not to just look at best practices, but look at the appropriateness of the tools that have been used in the past before, you know, moving forward with them. Okay.
Sure. So, as you know, we sent the bill yesterday. So we're going to meet again. I'm going to hold the bill, but we're going to have to meet again. Okay. So what I'd like you to do, Delegate Hill, is to read the bill and then come up with an amendment that has that language. Okay. And then the committee will consider it. Anyone else that has a question or concern, this is the time. I'm going to hold it and then have Delegate Hill read it and come up with language if necessary, okay? So we'll probably meet tomorrow sometime in between. We will definitely meet sometime tomorrow in between, the floor work. Any other questions that you may have or concerns? Seeing none, thank you very much. I really appreciate your time and your efforts, okay? I hope you have a blessed afternoon. You have about 28 minutes to get something to eat. Bye-bye.
Thank you. Bye-bye.
Bye.